Ashley Amaral, and I will be demonstrating how to give an IV medication through the CIVA mini infuser. So our patient today is Amaral, and she does have a respiratory infection. She has pneumonia, so she'll be getting the antibiotic Cefazolin. So I already checked the MAR against the physician's orders to make sure it's transcribed properly, and then I also had the MAR with me as I was getting the medication from the Pyxis machine. So now that I have the vial, I will check it against the MAR. So our patient is Amaral, and she does have a shellfish allergy, which we will reconfirm when we go to the bedside. So the right drug is Cefazolin. The right dose is 650 milligrams, and we have a 1 gram vial here, so there will be enough. The right route is IV. We're going to be giving through the CIVA infuser. And then the right time, it's due every 8 hours. It's due now, so that's good. So then I will check the parenteral drug monograph. And it says Cefazolin. It can be administered by a student nurse, so we're good with that. The usual dose is 500 milligrams to 1 gram, so we're within the usual dose. The max single dose is 2 grams, so we're well below that. So we will be reconstituting this powdered medication. So since we have a 1 gram vial, we will be adding 10 ml of sterile water for the injection, and the final concentration will be 95 milligrams per ml. So I make sure that I have my sterile water here. And I'm going to need a 10 ml syringe and a blunt fill. So take the caps off. And I would have done hand hygiene beforehand as well. And I'll be swabbing each vial for 30 seconds and letting it dry for 15, but for the sake of the video, I'll just speed through that. So 30 seconds, let it dry. And 30 seconds and let it dry. So maintaining sterile technique, and I'm going to butterfly the packaging like this and make sure I don't touch the tip. Okay, so I have to instill 10 ml of air into the sterile water since I'm trying to withdraw 10 ml.
So I'm going to put it in the med waste.
So I'm going to tap off all the bubbles to make sure I have the proper dosing.
And there's no bubbles.
Okay, so there's 10 ml.
I'm going to be injecting it into a 25
And I did not touch this, but if I did, I would just re-swab it.
Saline is compatible. So it says I can dilute 25 to 100, and because she has hypertension, I'm going to put her on a lower fluid because we need to lower her blood pressure. Okay, so
And I would let the air come out from,
okay.
let the air come out of that.
So, and I have my label prepared already. So, right patient.
And then gently roll the vial to make sure all the powder gets reconstituted.
Right dose, 40 milligrams.
Okay, so I see that there's no sediment there. So now, since the final concentration in this is 95 milligrams per ml, I will be withdrawing 6.8 milliliters of the Cefazolin.
So now I'm going to prepare my mini bag.
So I'm going to put 6.8 milliliters of air, and then just double check that I actually re-swab.
I'm going to hang it off the edge here to maintain stability. So I'm going to
So swab for 30 seconds, let it dry for 15. Withdraw the medication and then just push back the air.
because I want the dose to be equal throughout the infusion. So I'm going to apply my label that I made.
Tapping off any bubbles.
So my final volume in here is patient is 1.38 milligrams per ml because I added 40 milligrams into the solution. So I'm going to collect my supplies here, what I need. So I need my secondary set. I need my medication, and I need a label for my secondary line. And I'm done with my medication file. I'll put that in the sharps as well. So I'm going to enter the room, perform hand hygiene. Hi Emma, my name is Rachel. I'm a student nurse. I'm going to be giving you your furosemide
some medication escaped.
I'm just going to do my third and final check here. I'm going to check the IV
Making
line.
sure that I did not touch the top.
Standpoint. So she has her D5 normal saline running, and I can see that the drips are coming out here. You can see that. Good. It's labeled here, so the tubing is not expired yet. It's going through the pump at 30 miles per hour for TKO. All the clamps are open here. And how is your IV site doing? And there's no redness, there's no swelling. Are you having any pain? No pain? Okay, perfect. I'm just going to do my third check while I have a wristband available to me. I'm going to check the name
Don't have
here.
the proper dose here, so just make sure I get the proper
Can you tell me your
dose.
name and birthday? Perfect. Excellent. Okay. So I'm going to do my third med check here. So, right patient, Emma Wrightson. No known allergies. Do you have any allergies that you're aware of?
And then over a trash can or a sink, I would just
the
make
right
sure that I have the 6.8
milligrams, and I added the 4 mils into this bag. Right root IV, we're giving it a piggyback.
and make sure I don't touch the tip of that.
And it has not been given.
So now we'll do the second med check. Then I have the vial and this before I further dilute it. So it's Cefazolin. So right patient is Amaral. The right drug is Cefazolin. The right dose is 650 milligrams. So that would be the 6.8 mLs, which I do have
I'm going
here.
to now connect my secondary set to my piggyback.
So, and then the right route's IV, and then the right time every 8 hours, it is due now. So according to my CIVA chart, it says that I need to give it in 10 mLs in a 10 ml syringe. So since I have 6.8 here, I will need 3.2 additional milliliters of normal saline, and it's going to be given at a rate of 26 minutes at a normal speed. So I would take my normal saline, swab for 30 seconds, let it dry for 15. And then I will have an additional syringe. So I need 3.2. So I'll be putting 3.2 mLs of air.
I'm going to hang this for now.
And then withdraw the 3.2 mLs.
I'm also going to label my tubing at this point. These intermittent expire quicker. So I have the date, the time, and my initials there.
So I'm going to pull this back to 10 because that's how much liquid needs to be in the syringe.
To regulate the flow of the secondary.
And then without touching the tops,
So I'm going to swab this
I'm going to put in my 3.2 mL. Okay, and then I wouldn't recap this. I just put this in the sharps as well as my used vials. Okay. And then before I cap this, just make sure that there's no air bubbles. It's at 10 and I have a little bleb at the top. So then without touching the tip,
Maintaining sterility, I'm not going to touch the ends. I'm going to attach.
cap that. Okay. And then I have my label prepared. So it has the patient's name, Emma Watson, the Cefazolin, 650 milligrams in 10 ml. So the concentration here is 65 milligrams per ml. The date, time, and my initial. And then I would just make sure that I'm not covering up the numbers so you can actually see. So I have to make sure I have all my supplies ready as I enter in. So I also need my micro tubing. So then I would knock on the patient's door, perform some hand hygiene. my entrance safety check, just make sure that the rails are up, call bells within reach there.
So in this case, I'm going to deliver it over 10 minutes.
And then I would introduce myself to the patient. So, hi Emma, my name's Ashley. I'm a student nurse here and I'll be giving you your IV antibiotic. So you're going to receive Cefazolin. So that is for your respiratory infection. So can you just state your name for me?
So I have 29 mils.
And I compare that to my MAR.
And so 174 mils per hour, 29 mils to infuse.
Okay, so Emma Wrightson. And then what's your date of birth?
Start.
Okay, good. And then are you allergic to anything?
And now I'm going to watch
Shellfish. Okay, so we're still okay to give Cefazolin. I'm just going to check your IV site here. And does it hurt at all? No. And I don't see any redness or swelling, and it looks like the site is patent. I see that the normal saline is running at the appropriate rate, and that's compatible with my Cefazolin.
That is just a common side effect of the furosemide, which I'm sure you've been aware of.
So some side effects might be nausea, vomiting, or some rashes. So if you experience any of those, make sure you let us know and you can send your certification. Okay, good.
I put the bed rails up before I
So now before I prepare, I'm going to do my third bedside check. So right patient, am I right saying the right drug is Cefazolin? Cefazolin, the right dose is 650 milligrams, which I have in my 10 ml syringe.
Was it better?
And then the right route, we're going to give it through the IV CIVA pump. And then the right time, every 8 hours, and it is due now, so that's good. So now I'm going to forward prime.
Yeah, we wouldn't get through that one though.
So I'm going to attach this.
So first I will.
This ensures that the pump can regulate
Or I guess you don't want
flow rate of
Okay. Well, yeah, so you're not gonna try again.
One way or another.
I think we have 13 minutes by the time we started.
for 30 seconds and let it
Make sure that I do not touch the tip.
that was good.
I think so. Yeah, I think either one would be fine. Probably the second one a little more so.
Okay, so there.
I use the second
Do not touch the tip of that.
one. You can see the dose better, but
Connect that to my syringe. And I make sure this is good. And then I would forward prime just until I see a little bleb and that there's no air. Okay. And then I see the bleb, so I'll reattach that without touching.
And reconstitute. Then it would be.
Okay, Emma, so I'm going to attach this to a port below the Baxter pump here with an alcohol swab.
yeah. But I'm saying if I do it the first time, I'll only have one time.
I'm going to start it for 30 seconds and let that dry for 15. And then without touching the tip, connect that to the port. Okay. And then I will just clamp this down to make sure that while I'm putting it in the CIVA pump that I don't accidentally push down on the plunger.
blood to be running at the appropriate rate. We want your heart to stay working.
So you're gonna get like let's say you end up putting it in like at 20 ml final concentration. But see, you get your 20 ml syringe and like let's say you need 5 ml to dry.
5 mLs of the drug after it's been
After
reconstituted.
it's been reconstituted, then let's say that you're adding 5 ml.
I'm going to push this down, and then it said they need to be given within 26 minutes at a normal speed, so I see that it does match up with the 26 minutes on there. Now reattach that, and I go start normal. And I see that it is blinking through the green light, so that's good. I would stay with the patient for a couple minutes just to make sure that she doesn't experience any immediate adverse effects. So Emma, again, if you experience any side effects, such as the nausea, vomiting, rashes, make sure you do use your call bell. And while I'm still here, I would document on the MAR with my initials, designation, and time that I'm giving the med. And I would also return with the 3 ml normal saline syringe. And I would put that in at the normal rate as well as this already diffuses through, just to make sure that any additional drug in the tubing is delivered.